viewers. I am Dr. Rashidata Fouad Kamara, a Sierra Leonean. I am a clinician with background in infectious diseases and tropical medicine. I am making this video with the Academy of Medical Sciences. I am here to actually talk about life generally in a disease outbreak and responding to disease outbreak as a clinician. When we had the Ebola epidemic in 2014, I was among the first responders, and I had to man a facility of 100 bed capacity. It was a very tough period, and it's disheartening to see after all your efforts, your patients losing their lives. But one thing that I'll clearly state here is that I worked with Dr. Timudemsi, and I learned something very valuable from him, and that was, whatever it is, maintain human dignity. In simple words, behind clinical medicine, there is humanity. Well, basically, what happens is that when you are actively involved in managing infectious disease cases, you have to think about your friends, your family, and to keep them safe, you have to undergo so much. For instance, for me, I stay alone. I don't have anyone at home when you go home because you have to be very cautious, and that is very depressing, going home to an empty house. When we had the Ebola epidemic, I saw a lot of situations where, like for instance, a family of 22, all of them died except for 2. So you go home with those images in your head, and you have to go through them alone. Probably you'll have your support system. For me, it's my husband, my mom, my younger sister, and colleagues at work. They'll help you, but then there is no form of like a formal psychosocial support, no. And now with coronavirus, the disease spectrum is from like mild to moderate to severe to critical. And then within a twinkle of an eye, you'll see your patient deteriorating. And maybe you left your patient stable, and the following morning, you come in, the patient is gone, or the patient is in a critical state. It is really tough to manage these cases, and let me say this, it's like removing your heart from thorns. And then you have to think about yourself again, your safety. In Africa, with inadequate PPE, the ICU is not that equipped, so it's actually a tough call. But however, we're doing all we can, and I think this is the time for us to implement and aggressively implement public health measures like hand hygiene, cough etiquette, stay at home. These are things that we have to put in place, and people must know that we are out there trying to save their lives, and they should be helping themselves too. They are helping themselves, and they are helping us. And again, to my colleagues out there, there's only one thing I'll have to say at this point. In as much as we are trying to save lives, we have to protect ourselves. I implore you all, while saving lives, please stay safe. This is time to build a support network. I wish you all the best, and I hope we can have adequate measures to protect ourselves